Hello, I'm Dr. Sita Lakshmi from OJS Aesthetic. I'm an aesthetic physician and aesthetic gynecologist. You must be wondering what are these two things doing together? Yes, aesthetic practice is all about body wellness. So I have been very active in treating gynecological clients with aesthetic treatments. Today, I would address you a functional problem. It's not exactly an aesthetic problem, but it's a functional problem that many women in the menopausal group face it. Our premenopausal group also face this condition. It is called urinary dribbling or stress incontinence. Most people have heard this term that there is a small leak in the urine, and they colloquially say, I leak often. I have to use the loo often. So, this symptom is called stress urinary incontinence or SUI of menopause. SUI of menopause is very, very specific in that it occurs when they are in an active life, and when it occurs when some kind of a stress like coughing, sneezing, or lifting some weights or some strenuous work cause them to leak very accidentally. So this causes much of embarrassment, a problem to move around because of the undergarment wetting and a lot of excoriation. So they keep avoiding many situations which happen, which go about causing this, and they may actually avoid social settings and social interactions. This makes them very depressed, and this can become a symptom of menopause. There's the reason for people think that menopause causes mood swings, but it's not exactly mood swings, but it is often because of the functional problems that interrupt us in psychological behavior. So, as a woman, I understand that it's very crucial for us to treat such conditions, to make them know better, give them the knowledge that is required to help them in bettering their lives, and also to help them in their menopausal age. So here I've studied fellowship to understand these things and to do some hands-on training before I can come before you and claim that I have the knowledge. So to share this knowledge, I'm here talking to you about the urinary incontinence today. So urinary incontinence can happen in the menopausal age group because of the hormonal changes that happen in the body. Along with the hormonal changes, the other lining of the genitalia, the muscles also weaken. Therefore, the actual problem is the lack of closure of the urinary opening, that is the urethral opening, so that the urine leaks out when it has to contract and actually close. Whenever there is an increased abdominal pressure in our normal age, the sphincter actually closes. And when there is a relaxation, the sphincter opens and there is urination. But this here becomes an opposite because the muscles are not acting adequately. There's a weakness in the pelvic floor muscles, and this causes the urine to leak. This is definitely, that is why it is called stress incontinence. Some stress that is leading to incontinence of the bladder, that is the bladder to leak. Even with even when the client wants to stop this, it is becomes unconditional. Now, along with this, there are other genital problems that can happen in the menopause: vaginal irritation, dryness, and a lot of other dysuria or symptoms of urge to go into to the loo often. So, together with all these symptoms, sometimes it is called genitourinary syndrome of menopause. But urinary incontinence is so specific that it has to be diagnosed and it has to be delineated. It cannot be clubbed with other kinds of incontinence. So we have to actually rule out other causes of incontinence and then cause it stress incontinence of menopause. Stress incontinence of menopause, when treated early, gives very good results, and it is very common. And it's seen that 1 in 3 ladies in women in this age group, the perimenopausal age group, suffer from stress incontinence. What are the treatments like? Of course, education of how to empty the bladder, how to avoid stressful situations and accidents have to be dealt with. Urinary irritants like alcohol, like the cheese or the dairy products, or some of the acidic nature of the acidic nature drinks have to be avoided so that they can also that doesn't also irritate the bladder and cause urinary incontinence. Apart from that, there are some in-office procedures that I will be talking about. Before going to the in-office procedures, we have to try the Kegel's exercises, that is the pelvic floor strengthening exercises, which have to be taught, and they can be done at home or in their own setup, or in a pelvic muscle training machines are available, which can actually simulate the contractions that happen in the pelvic muscles, and which are helpful. This can be delineated by a pelvic physiotherapist, and then this can be educated to them. And similarly, Kegel's exercises can be explained and incorporated into their everyday life. But this may not be sufficient to solve the problem. When this is not sufficient to solve the problem, we have to other in-house treatments or in-clinic treatments. Some of them are like PRPs, the cell-based therapies, that is called, because PRP is prepared from the autologous blood sample, and it has many enzymes and many cytokines which can strengthen the musculature, which can strengthen the collagen layer, the support, and give a support to the urethral bladder. So this happens over a period of time, and sittings may have to be repeated. It's a small procedure. It can be done under local anesthesia or topical anesthesia, and the client can leave the office immediately. There are other treatments called energy-based treatments, and here we have the lasers, we have the ultrasound, or the um, radio frequency devices. All of them or induce a change in the collagen of the lining of the vagina, and indirectly they support the urethral bladder. After the ablation, there is a regrowth and there's a regeneration of the collagen. Therefore, this causes a improvement in the bladder neck. The bladder training, supportive treatments like avoiding certain substances and other medications apart from the estrogen replacement or the hormonal therapy can help these people to tide over this condition and lead a happy life. If the patient is very frail and they cannot follow certain things, probably and a treatment at home with the medications is always helpful. The beta agonists, which can help the treatment, are very useful in this condition. Also, there are certain mood elevators which can be given and which also help in treating this condition. Nutritional needs and other treatments or supportive treatments are also useful in helping the client to tide over these situations. In very frail or very adult people, in old age people, I think bladder training, proper emptying, and use of underpads or the urinary leakage pads have to be advised well often, and the excoriations which happen because of the continuous leak have to be treated. So I hope people will understand that these symptoms happen and they have to report it early. They have to seek help from an aesthetic gynecologist so that they can help them in a better way. In a busy schedules of a gynae, these problems are always neglected. I mean, they're overlooked if not neglected, and the treatments can be delayed. Therefore, it is wise and better to share this knowledge among the people and to have a better results.